Every 40 seconds, someone in this country slips a little further from the person they used to be. And by the time this video ends, dozens more will have taken a pill tonight that is quietly working against the one thing they cannot afford to lose, their mind. Not because they were careless, not because of anything they did wrong, but because someone in a white coat told them it was safe, and they had no reason to doubt it. I'm Dr. Mason Hayes. In my years of practice, I have sat across from more families than I can count who came in confused, frightened, and convinced they were watching a parent, a spouse, or themselves disappear into dementia. And in a surprising number of those cases, the culprit was never a disease at all. It was sitting right there in the medicine cabinet, a common, ordinary, doctor-approved medication that nobody ever thought to question. Here is what the newer research keeps confirming, and it is something most people over 60 have never once been told. A single class of everyday medication, the kind millions of people take without a second thought, can pull your memory, your focus, and your ability to learn down hard inside a single year. And the frightening part is that most people taking it feel it happening but blame it on age. Today I am going to walk you through the 9 medications most strongly tied to rapid memory loss in older adults. We are counting down from the ones that get quietly overlooked all the way to the one I consider the single most destructive influence on the aging brain. Watch closely for number 3, because it is handed out to millions of seniors for a problem that sounds completely harmless, and yet it may be silently eroding the memory centers of your brain right now, without giving you a single clear warning until real damage is done. Before we begin, do me a favor, drop a comment and tell me your age and which medications you take every single day. I read them, and the makeup of this audience genuinely shapes what I cover in future videos. Now let's start at number 9, and please do not let that low position fool you, because this one is sitting in nearly every household in America right now. Number 9 is diphenhydramine. You almost certainly know it by its drugstore name, Benadryl. It is that little pink pill people reach for to fall asleep, to quiet an allergy, or to soften the misery of a cold. It costs a few dollars, it sits out on an open shelf with no prescription required, and because of that, most people assume it must be gentle and harmless. Inside your brain, however, it is doing something far more serious. Benadryl belongs to a group of drugs called anticholinergics. That is a complicated word for a simple idea. These drugs block a brain chemical called acetylcholine, and acetylcholine is the messenger your brain relies on to form new memories and to stay sharp and alert throughout the day. As we grow older, the brain naturally produces less of it, and it leans harder on every last bit it has left. So a drug that blocks it lands far heavier on a 70-year-old brain than it ever would on a 30-year-old one. The region that absorbs the damage is the hippocampus, the small seahorse-shaped structure deep in the brain where new memories are first formed before they get filed away for the long term. In my own practice, I have watched patients take a nightly antihistamine for years, slowly losing their sharpness and never once connecting that growing fog to the innocent pink pill sitting on the nightstand. The research spells it out plainly. A study following older adults who used anticholinergic drugs regularly found a dramatically higher risk of developing dementia compared with those who stayed away from them. That is far above the normal risk from something most of us treat like harmless candy. So here is what to do. Read the label on anything you take to help you sleep and anything marked PM, nighttime, or allergy relief, because those products are very often just diphenhydramine wearing a different costume. If you take it for allergies, there are newer antihistamines like loratadine, sold as Claritin, that do not cross into the brain the way Benadryl does and are far safer for long-term use. Never stop a medication on your own, bring it to your doctor. But stop assuming that over-the-counter automatically means safe for your memory. That is number 9. Number 8 is one your stomach absolutely loves and your brain quietly pays the bill for. Number 8 is the proton pump inhibitors. The big names here are omeprazole, sold as Prelosec, and isomeprazole, sold as Nexium. These drugs shut down acid production in the stomach, and they get handed out freely for heartburn, reflux, and that burning discomfort after meals. People stay on them for years, sometimes even decades, because the moment they try to stop, the symptoms come roaring back, so it feels like the medication is the only thing holding the line. But here's the part almost nobody hears at the pharmacy counter. Your stomach actually needs acid to pull certain nutrients out of your food, and chief among them is vitamin B12, which protects the wiring of your nerves and your brain. Turn the acid down far enough, for long enough, and your B12 levels quietly drop. So do magnesium and calcium, 2 minerals your brain cells depend on to fire and signal cleanly. Starve the neurons of those, and you get misfires, confusion, and memory slips that can look exactly like early Alzheimer's, when the real cause is a nutrient your medication has been quietly blocking all along. A large study examining tens of thousands of people aged 75 and older found that regular users of these acid-blocking drugs had a meaningfully higher risk of dementia than those who did not take them. And the concern runs deeper than nutrients alone, because these drugs have also been linked to higher levels of amyloid beta in the brain, the very sticky protein that accumulates in Alzheimer's disease. So here is the move. If you take one of these acid blockers every single day, that is exactly the conversation to bring to your doctor. Many people can carefully taper down onto a gentler class of drugs called H2 blockers, like famotidine, sold as Pepcid, which is far less likely to affect your thinking. Some people find relief with diglycyrrhizinated licorice, a natural compound that coats and soothes the stomach lining without any cost to the brain at all. The goal is always the lowest dose for the shortest possible time, not a pill you keep taking forever out of pure habit. Number 7 is prescribed for a problem most people would honestly rather not discuss out loud. Number 7 is the bladder drugs, and the one to know by name is oxybutynin, sold as ditropin. It is given to seniors who struggle with a sudden, urgent need to reach the bathroom, the kind of overactive bladder that can reshape and dominate an entire day. The relief it brings is real, and the embarrassment it spares people is real too. But oxybutynin works by blocking acetylcholine, the exact same memory chemical that Benadryl blocks. And this particular drug slips across into the brain very easily, parking itself right where memories are formed. That makes it one of the more dangerous entries on this entire list for an older adult, especially when it is taken month after month, year after year. A major study of people over 65 who took strong anticholinergic drugs like oxybutynin for more than a year found their risk of dementia was substantially higher, roughly 1.5 times the usual risk. And here is what truly troubles me. Almost none of them were ever warned. They were simply told a pill would calm the bladder. Nobody mentioned it might be dimming the mind at the very same time. So the resulting fog gets blamed on age. People describe forgetting appointments, losing their keys a dozen times a day, dropping the thread of a simple conversation, and everyone around them just nods and says, "Well, you're getting older." It is rarely traced back to the prescription until real ground has already been permanently lost. If you take oxybutynin and you have noticed your memory slipping, please take that seriously, because you truly do not have to choose between your bladder and your brain. Newer drugs like mirabegron, sold as Myrbetriq, work through a completely different pathway and do not block acetylcholine at all. For most older adults, they offer the very same control, with far less risk to clear thinking. Bring it up at your next visit and ask directly. Number 6 might be the most surprising entry on this whole list, because it is one of the most prescribed drugs on the entire planet. Number 6 is statins. Simvastatin and atorvastatin, sold as Zocor and Lipitor, are among the most prescribed medicines in the world, especially after the age of 60, and they do a genuinely important job, lowering cholesterol and reducing the risk of heart attacks and strokes. Statins belong in a great many people's lives, and this is not a case against them at all. What follows is simply the half of the story that usually gets left out entirely. Cholesterol does far more than affect your heart. Your brain is close to 60% fat, and it uses cholesterol to build the myelin sheath, the protective insulation wrapped around every nerve so that signals travel fast and clean. Lower cholesterol hard enough, with a strong enough statin, and you can leave the brain short of a raw material it actually depends on. The statins that cause the most trouble here are the ones that cross most easily into brain tissue. Research on adults over 70 who had been taking statins for more than 3 years found a noticeably higher rate of mild cognitive impairment, and the higher the dose, the steeper the decline tended to be. Some patients describe genuinely frightening blanks. A familiar name suddenly gone, a conversation they just finished completely erased, a route they had driven for 20 years abruptly turning unfamiliar. The important thing to understand is that not every statin affects the brain the same way. Pravastatin and rosuvastatin do not cross into brain tissue as readily and are generally considered the safer choices when it comes to preserving cognitive function. So if you have been on a statin for years and you are noticing fog, forgetfulness, or confusion creeping in, that is a real and worthwhile conversation to have with your doctor about a lower dose or a switch. It is absolutely not a reason to quietly stop a medication that may well be protecting your heart. Get the plan right with professional guidance, never on your own. Quick pause here. If this is helping you connect the dots, take 1 second and tap that like button. It genuinely helps this information reach more seniors who desperately need to hear it. And while you are down there, tell me how many prescriptions you are currently taking. I read every single comment. Alright, back to the countdown. Number 5 is the benzodiazepines. Lorazepam, sold as Ativan, diazepam, sold as Valium, alprazolam, sold as Xanax. These are among the most commonly prescribed drugs in America for anxiety and for sleep problems. They work by boosting GABA, the brain's natural calming signal that turns down an overactive nervous system. At first, they can feel like a genuine rescue. The panic eases, the racing thoughts slow down, and sleep finally comes. But over time, the picture begins to change in ways people rarely expect. A study that followed thousands of seniors over 6 years found that those who used benzodiazepines for longer than 3 months had a significantly higher risk of developing Alzheimer's disease. The longer-acting medications, such as diazepam, appear to be even more problematic because they linger in the body longer and accumulate in fatty tissues, including the brain itself. What these medications essentially do is create a slow chemical sedation across the entire brain. Learning becomes slower, mental flexibility decreases. Many people describe a strange emotional flatness as if they are moving through a permanent fog and no longer feel entirely like themselves, and the cruelest part is the exit. If a benzodiazepine is stopped abruptly, the anxiety and insomnia often return with even greater intensity, accompanied by agitation that can become genuinely dangerous. That makes the medication feel absolutely indispensable at precisely the moment it may be causing the greatest harm. So here is the rule, and it truly matters. If you have been taking a benzodiazepine for more than a few weeks, do not stop suddenly, because doing so can be life-threatening. Work closely with your doctor to taper the medication gradually, over weeks or even months. There are gentler alternatives. Buspirone, for example, can help with anxiety without causing sedation or mental clouding. And there are specialized forms of talk therapy designed specifically for insomnia and anxiety that can restore calm without any cognitive cost whatsoever. Now let's move to number 4. Number 4 is a single medication prescribed for 3 entirely different problems, and it carries one of the heaviest hidden burdens on this whole list. Number 4 is amitriptyline, sold as Ilavil. It is an older antidepressant that is still widely prescribed today for nerve pain, sleep difficulties, and even migraine prevention. That very versatility is exactly why it became so widespread. It looks like a medication that can do just about everything. But beneath the surface, it is one of the most powerful anticholinergic drugs still in common use anywhere. That means it strongly blocks acetylcholine, the very chemical your neurons rely on to communicate with one another and to store brand new memories. It blocks acetylcholine so aggressively that with long-term use, memory problems stop being a rare side effect and start to resemble an expected outcome. A large study following thousands of adults aged 65 and older found that those with the highest cumulative exposure to anticholinergic drugs such as amitriptyline over a 10-year period had a substantially greater risk of developing dementia. And almost none of them were ever told the medication could do that. They were given it for sleep or for pain, then gradually noticed words disappearing, memory thinning out, and concentration weakening, and they simply assumed it was all just part of getting older. It does not even require a high dose. A small nightly dose, taken faithfully for years, can quietly erode cognitive function with no obvious warning signs, right up until the loss becomes significant and undeniable. If you or someone you love takes amitriptyline, that is a conversation worth having very soon. For nerve pain, options such as duloxetine or gabapentin may provide similar relief without carrying the same anticholinergic burden. For sleep, melatonin or a very low dose of doxepin, which is considerably gentler on this chemical pathway, may serve as safer alternatives. And for mood, newer antidepressants such as sertraline or escitalopram are generally considered far safer for the long-term health of the brain. Number 3 is the one I told you to watch for, because it is prescribed to millions of people for something that sounds completely harmless. Number 3 is paroxetine, sold as Paxil. It is one of the most widely prescribed members of a family of antidepressants known as SSRIs, used for both depression and anxiety. On the surface, it appears to be a modern, gentle option, far kinder than many of the older psychiatric medications. But here is the detail that is rarely ever discussed. Paroxetine is the one SSRI with strong anticholinergic activity. That single characteristic sets it apart from related medications such as sertraline and escitalopram because it disrupts the very same acetylcholine system that every other medication on this list has been attacking. A large review examining older adults taking different SSRIs found that paroxetine users demonstrated measurable declines in short-term memory, word recall, and attention within the very first year. Seniors taking paroxetine were noticeably more likely to show early signs of cognitive impairment than those using other antidepressants, and there is a painful irony buried in that finding. The medication is prescribed to help stabilize the mind, yet over time it may erode the very clarity it was meant to protect. The solution here is fairly straightforward. In older adults, paroxetine is generally a medication worth avoiding whenever safer alternatives exist. The American Geriatric Society placed it on the Beers list, a formal catalog of medications considered potentially inappropriate for seniors, and paroxetine appears there for precisely these reasons. If you take it, speak with your doctor about the possibility of switching to a safer SSRI, such as sertraline or escitalopram, which are gentler and do not carry the same cognitive concerns. Supporting healthy levels of B vitamins, especially B12 and B6, may also help support mood alongside those changes. Number 2 is prescribed so quietly that many people taking it do not even realize what type of medication it truly is. Number 2 is antipsychotic medication, and this one concerns me deeply because many individuals taking these drugs never knowingly agreed to take an antipsychotic in the first place. The names include quetiapine, sold as Seroquel, risperidone, sold as Risperdal, and olanzapine, sold as Zyprexa. These medications were originally developed and approved for serious psychiatric conditions such as schizophrenia and bipolar disorder. Today, however, they are frequently prescribed off-label to older adults for sleep problems, mild restlessness, or the agitation associated with dementia itself. Powerful medications designed for severe psychiatric illness are now routinely used in homes and nursing facilities for seniors who are simply confused, restless, or difficult for busy caregivers to manage, and the cost can be substantial. A study following tens of thousands of older adults found that those given antipsychotic medications for behavioral symptoms were far more likely to experience worsening cognitive decline within a single year, even when they had no history of dementia at all before treatment began. These medications can also raise the risk of stroke, sudden cardiac death, and the profound sedation that contributes to dangerous falls and hospitalizations. They work by suppressing dopamine, a chemical involved not only in mood regulation, but also in focus, planning, and memory. Reduce dopamine enough, and the brain becomes slower and far less responsive. That is exactly why some individuals taking these medications can appear dull, emotionally flat, or almost absent, while their families quietly grieve the gradual disappearance of someone who is still physically present in the room. If you or a loved one is taking one of these medications, the first step is to ask the prescribing physician a direct and honest question. Why was this medication started, and is it truly necessary, or is it being used primarily for convenience? Many behavioral symptoms can often be improved without any medication at all through consistent daily routines, reduced noise and overstimulation, treatment of hidden pain, and better management of sleep and lighting. When medication is genuinely required, the lowest effective dose for the shortest possible duration helps reduce the harm. Far too often, families are never informed about what these medications can do to the brain. They watch a decline they believe is simply aging, when the true cause may in fact be chemical. Now we arrive at number 1, and number 1 is not a single medication at all. It may be the single biggest hidden driver behind nearly every story I have discussed today. Number 1 is anticholinergic polypharmacy. It is the danger almost nobody talks about, and it may be one of the leading causes of medication-induced memory loss in older adults anywhere. You are probably expecting one final villain, one single worst pill, but the reality is far more subtle than that. The greatest danger often comes from the slow accumulation of multiple anticholinergic medications taken together, while nobody ever calculates the total burden. Polypharmacy simply means taking many medications at the same time. Anticholinergic burden refers to the combined effect of all those medications blocking the same memory-related chemical simultaneously. Imagine a very common scenario. A senior takes Benadryl every night for sleep, oxybutynin every day for the bladder, and amitriptyline for nerve pain. Individually, each medication may produce only a small, barely noticeable effect. Together, however, those effects compound, and the burden on the brain rises rapidly. A study tracking hundreds of thousands of older adults found that those with the highest anticholinergic burden had more than double the risk of dementia within 10 years, and the overwhelming majority had absolutely no idea they were even taking anticholinergic medications at all. Nobody had ever explained it to them. When acetylcholine is blocked from several directions at once, the brain does not simply slow down. Neurons can begin to weaken from underuse. Connections may shrink, and the brain can settle into a quiet, underpowered state that looks remarkably similar to Alzheimer's disease during cognitive testing. But here is the hopeful part, and it is the entire reason I made this video. Medication-induced cognitive decline is often reversible when it is caught early. Reduce the burden, and many people regain their clarity, their energy, and their memory within a matter of weeks or months. The brain is far more resilient than most people ever realize, but only when the true source of harm is finally removed. The solution does not require a miracle, it requires a careful medication review. Sit down with your doctor or your pharmacist and review every single prescription medication, every over-the-counter product, and every supplement you take. Add up the total anticholinergic burden. Simple scoring tools exist to help identify that exact risk. Once the problematic medications are identified, the unnecessary ones can be reduced or discontinued under medical supervision, safer alternatives can be introduced, and the brain can finally be given a real opportunity to recover. This may well be the most preventable threat to the aging brain on this entire list, and that is precisely why it holds the #1 position. Now, I want to hear from you directly. Of these 9 medications, which ones are currently sitting in your medicine cabinet right now? Have you noticed brain fog or increasing forgetfulness after starting something new? Tell me in the comments below, and tell me that you will ask for a full medication review this very week. Your answer might just be the very thing that helps the next person who reads it. And before you go, there is one more place your body hides its warnings. Your medicine cabinet is one place. Your hands are another. Your fingernails can reveal warning signs involving your kidneys, your blood, and even your nervous system, sometimes years before other symptoms ever appear. Most people never learn what to look for. That is the topic of my next video, where I will show you the 4 nail signs worth checking tonight. I'm Dr. Mason Hayes, and I will see you there.